In a world without doctors, hospitals, or pharmacies, a simple infection can be a death sentence. Medical preparedness in a collapse is not about having a box of bandages, it's about building a comprehensive system to prevent, manage, and treat the most likely, life-threatening conditions you will face. This is an in-depth look at the medical preps that truly matter. Tier 1. Trauma and immediate life threats. These are the non-negotiable items that address the most immediate and persistent threats to your life. Without the ability to handle these, nothing else matters. Massive bleeding control, this is the #1 priority. Your kit must contain more than just adhesive bandages. You need a military-grade tourniquet, like a CAT or soft W, and the training to use it correctly on a limb. For wounds where a tourniquet can't be applied, you need pressure dressings, like an Israeli bandage, and hemostatic gauze, such as QuickClot or Silox, to help clot the blood faster. Finally, for penetrating chest trauma, you need chest seals to treat sucking chest wounds. Airway management. While advanced airway tools are beyond most people's scope, you must have the knowledge to handle a blocked airway. This includes understanding the recovery position to prevent an unconscious person from choking and basic CPR skills. Tier 2. Infection, illness, and chronic care. This tier addresses what will kill you over days or weeks. This is where most post-collapse deaths will occur. Wound care and infection control. This is the bridge from trauma to long-term health. Your kit needs an irrigation syringe to flush wounds with clean water, antiseptics like povidone or chlorhexidine, a vast supply of sterile gauze in various sizes, and medical tape. Nitrile gloves are non-negotiable. You cannot treat a wound with dirty hands. Medications prescription. If you rely on any prescription medication, you must have a minimum 9-day supply. This is a critical, life-sustaining prep. Talk to your doctor about legally obtaining an extra supply for emergency preparedness. Medications, over the counter. This is your new pharmacy. Stock large quantities of painkillers and fever reducers like ibuprofen and acetaminophen. Anti-diarrhea medication like loperamide is crucial, as dehydration from sickness is a major killer. Allergy medication like diphenhydramine Benadryl is also essential, as it can treat severe allergic reactions. Antibiotics. This is a controversial but vital topic. In a collapse, a simple bacterial infection in a wound, or a case of pneumonia or dysentery, will be fatal without antibiotics. If you can legally and safely acquire a supply of broad-spectrum antibiotics like amoxicillin or doxycycline, and the knowledge to use them correctly, they will be one of the most valuable resources you own. Specialized kits. Consider a dental emergency kit with temporary fillings and pain relief. Burns are also common. Have burn gel and non-stick dressings. Tier 3. The foundation of health, prevention, and knowledge. This is the most important tier. The goal is to prevent medical issues before they start. Hygiene and sanitation. This is your primary defense against disease. Stock large amounts of bar soap, hand sanitizer, and disinfectants. Have a robust system for managing human waste to prevent the spread of cholera and other waterborne illnesses. Knowledge. Your most powerful medical tool is your brain. A physical medical handbook, like the Survival Medicine Handbook or the Where There Is No Doctor series, is an absolute must-have. Download these and other first aid guides to a solar-powered smartphone. But books aren't enough. Get real-world training. Take a Stop the Bleed course. Get certified in CPR and advanced first aid. Practice these skills. Vitamins and nutrition. A multivitamin is a simple but effective way to prevent the slow decline caused by nutrient deficiencies in a limited diet. Building a medical prep is not a one-time purchase. It is an ongoing system of acquiring supplies, gaining knowledge, and practicing skills. In a world where you are the first responder, this system will be the difference between life and death.